Good morning, and I'm honored to be here. Thank you, and I want to, again, congratulate Nassau University Medical Center for being the first in all of Long Island to implement the Greening the Cleaning program. And again, for the leadership, it's all really because of Arthur and his team here. All of you have been wonderful to work with, that this is done, because it really does take, you can educate someone or tell them about the information, but it really takes a leader that has that vision and can see really the importance and the impact for the better that it will have in a community immediately in your hospital with workers, all the employees, and all the patients that you take care of here. Greening the Cleaning started in 2000 out of Hackensack University Medical Center. And it was an idea I had, which really came out of working with sick children, children with sickle cell anemia, children with cancer, children with autism, neurodevelopmental disorders. And many of those illnesses, when you look at them, in a nutshell, a lot of them are triggered and caused by environmental pollution, environmental factors. And greening the cleaning is really a single fundamental step. And I looked at it in a really common sense way. When you look at all the cleaning chemicals that are used, and let's specifically talk about healthcare and in hospitals, it just didn't seem to make common sense to me that we would be using toxic chemicals. Chemicals, when I say toxic, I mean chemicals that are known and listed as human carcinogens, neurotoxins, endocrine disruptors, hormone disruptors. You know, they can cause asthma, breathing problems, respiratory problems. Of course, a lot of you, right? A lot of you here work in housekeeping. Are there any workers here? So specifically, you probably have experienced that, and all hospitals have in cleaning. Even moms at home, where you get burns, irritations that causes even depression, being exposed to a lot of these chemicals. It's not fun. With Greening the Cleaning, we've removed all that, and what we did, it's as simple as replacing all those toxic cleaning agents with non-toxic ones. And that means using the least level of toxicity, using products that don't have chemicals in them that are linked to cancer or affect the neurological system, cause endocrine problems that are not known as hormone disruptors. What we've witnessed with several hundred of facilities that we've implemented this program in healthcare, that you eliminate those frequent complaints of headaches, burns, maybe nausea, breathing problems, skin rashes, and a list of other things that do come up when you're exposed on a daily basis, full-time, working with cleaning products. So when I met Arthur a year ago, he immediately, in fact, they contacted us, and Karen, they all wanted to do this. And they just needed to know how to do it. And we have been doing this for 10 years now, and they've successfully implemented this program. You have over, what, 1 million square feet here, so that's a lot of elimination of, just think of when you use all these products, how we pollute our water. So immediately, not only do you now look out for the employees, and I think you'll see a big difference directly working with these Greening the Cleaning products versus the products that you were using. So immediately there's results with the employees. There's results with patients possibly being affected when they're exposed in hospitals. And hospitals are unique because, you know, of infectious disease and bacteria and germs. And then, you know, these products have been more scrutinized in a hospital setting for that reason. So back in 2000, when we came up with this idea with the Greening the Cleaning, of course, we were probably more scrutinized than the existing products out there to show that they did have that efficacy that all those toxic products do. So infectious disease department and asthma and the Department of Immunology tested these products. So that's how we've gotten to this point where it is successful, because you have a product line that not only is green or non-toxic, but also works. And in fact, many of the products have been proven to work as well, if not better, than all those leading brands that we all know so well. And the third thing is that we've been able to save all hospitals money. We're a non-for-profit, 501c3, and when we implement the program, to date, all of our facilities we've implemented, we've saved anywhere from 3% to 75% in cost savings. I know when we immediately implemented the program at Hackensack, we yield a 15% cost savings. So we'll see within a year or two what those results are here at Nassau University Medical Center. But again, when we implement the program and sell these products, 100% of those profits go back into the Deirdre Imus Environmental Center for Pediatric Oncology for, number one, our Greening the Cleaning program, and number two, for a lot of the studies that we're able to do now with children's health. Again, I congratulate all of you and thank you very much. Thank you.